Climate change is the greatest challenge of the century, and one we must all work together to tackle. Urbanization and population growth are pushing our planet towards a critical tipping point. Yet, this does not have to be our narrative if we take action now.
The Paris Climate Agreement is a historic step for climate action. It is a global acknowledgement that rising temperatures have the potential to cause massive disruptions to society, and it is a commitment by all nations to limit global temperature rise to 2 degrees Celsius. But how are we going to achieve 2?
We achieve 2 together. As 2 siblings studying distinct fields on opposite coasts of the United States, we have been unified by our passion to make climate change mitigation and adaptation a reality, and a recognition that the Paris Climate Agreement alone will not solve climate change.
We are making a call to action that architecture, public health, and all other disciplines must work together to give future generations a habitable world.
The role of architecture is pivotal to climate change mitigation. The built environment has the power not only to shape our actions, but also our footprints. Architects must shape the path for how we live in the future. To achieve 2, globally, we need to cut CO2 emissions to almost 0. And 90% of the building stock must be carbon neutral by 2050. Architects are critical to improving the efficiency of existing structures while ensuring that all new buildings and spaces strive to be net zero.
Human health and health systems are particularly vulnerable to climate change. Climate change is expected to alter the pattern of diseases, affect food and water security, and have physical and mental health consequences. As public health students and professionals, we must foster climate resilience and develop ways to have local, national, and international policies that strengthen health systems.
What we're saying is radically simple. Human health and the health of the planet are intrinsically linked. Take, for example, any mid-sized city around the globe that is currently experiencing rapid urbanization and the effects of climate change.
Now take that same city from the previous slide, and you will notice in the middle of the picture we have added green space. This addition of vegetation will help limit the heat island effect and improve air quality. You will also notice on the left side of the picture we have added mixed-use housing. By constructing this housing with local sustainable materials, we can reduce the footprint of this building and promote positive mental health benefits by fostering interactions between residents.
On the right side of the picture, we have added a renewably powered transit station that connects this neighborhood to the greater city. By helping residents travel in a more sustainable manner, it can reduce CO2 emissions, promotes physical activity, and prevents chronic diseases. These 3 small changes are only a tiny representation of the potential co-benefits of designing the built environment for sustainability and health.
But imagine if this conversation included educators, innovators, community members, engineers, and all other fields. Climate change cannot be solved in isolation.
So we want to leave you with one final thought today. What can you and your field do to help us all achieve 2?